Hello, friends and colleagues. Welcome to Health Talks, your insight into public health-related topics. I'm your host, Thomas McMinn, and in this episode, we have a very special guest, the Executive Director of the Utah Department of Health, Dr. Joseph Miner. All right, Dr. Miner, first and foremost, thank you so much for being on this episode. We're getting a little insight into who you are, which I'm sure a lot of the listeners want to know a little more about. So in order to jump in, I want to do first just a high-level overview of who you are and what you do for the Utah Department of Health.
Thank you, Thomas. It's my pleasure to give a perspective on public health and an introduction to myself. I am the Executive Director of the Utah Department of Health and have been in this position for the last 2.5 years. But my whole career, over 40 years, has been in preventive medicine, public health. And I'm really dedicated to this way of providing health care to the public. I mean, there are many different areas of health care, but one overarching feeling I felt that's so important that many, I think, don't appreciate is helping keep people well rather than waiting for them to become ill. And with the Department of Health, we have 1,000 employees and 2 divisions, a Center for Health Data, Office of Medical Examiner, State Laboratory. So we address many public responsibilities for addressing health in our community. And quite varied, and my responsibility, I see, is to kind of give my perspective and insight and with all of these different aspects of public health services that the Department of Health provides, but also basically one of my philosophies is that everyone does public health far beyond the Department of Health. You have many government agencies, many private agencies that do important things for a community that help keep us healthy and happy. So it goes far beyond the Department of Health also. But I like to contribute to that understanding as the state health officer as well.
How did you first become involved with public health?
After graduating from medical school, I wasn't sure what I wanted to do. I liked everything a lot and so I wanted to be in something kind of broad in health. And plus I owed the Air Force a couple of years for a scholarship. And so upon graduating medical school, I went into the Air Force. My first year was not a payback year. It was actually my internship down in Biloxi, Mississippi. And I did general internal medicine, which is medical conditions that are anywhere from allergies to heart attacks and strokes in general. So I finished that year, which was a clinical year in internal medicine, as mentioned, and then decided, well, I will do my 2 payback years to the Air Force. I signed up to go through the Air Force's primary course in aerospace medicine. And so they assigned me to Brooks Air Force Base, where they provide the primary course in aerospace medicine. That's basically a primary care physician for flight personnel, pilots, navigators, air traffic controllers, missile launch officers. So you learn primary care and medical attention for people in these fields of flight and the special stresses they undergo, and the primary focus of aerospace medicine or flight medicine is keeping pilots and navigators, air traffic controllers, keeping them safe, but more importantly, keeping the people they serve passengers in their airplanes safe as well. And so you address health conditions of these people in charge of flight that will keep them safe and keep the public safe. Then and that was just for the summer, for 3 months in the summer. And then I received an assignment to be the flight surgeon at Whiteman Air Force Base, which is just east of Kansas City, Missouri. And there, since it was a Minuteman missile base, I was the physician for all missile launch officers and their families, actually. You're kind of primary care physician for the families of flight personnel. So for 2 years, I did that work as the flight surgeon. But since it was a relatively small base, I was also assigned to be the public health director for the base and also the director of occupational medicine. Those are the 3 main areas of preventive medicine for which you certify with the American Board of Preventive Medicine: aerospace medicine, occupational medicine, and general preventive medicine, public health, for those 3 areas. So that was my introduction to all areas of public health. So upon finishing my 2-year obligation to the Air Force, I returned to the University of Utah School of Medicine and completed a residency in preventive medicine public health. And that was a joint residency between the Utah Department of Health and the University of Utah School of Medicine. It's where, and a residency is basically on-the-job training. You have mentors, but you're actually practicing your specialty on the job. Part of the on-the-job training, I spent 6 months with Harry Gibbons. Harry Gibbons was the director of the Salt Lake County Health Department. He was also had a career in with the Federal Aviation Administration as a flight surgeon, actually, but had 20 years eventually as the Salt Lake County Health Director. So the first 6 months were spent working with him, but then the director of the Weber Morgan local health department left. There was a vacancy there. The Department of Health and the University of Utah School of Medicine, this program, assigned me to be the interim health director for the Weber Morgan Health Department. So I spent the next year and a half being the acting director of that local health department. Upon completing my residency, this on-the-job training, they wanted me to stay there, but didn't want to pay me any more than a resident makes in training. And United States Steel offered me a position to be the medical director of occupational medicine at the United States Steel plant in Orem, Utah, the Geneva Steel operation. So I went to Geneva Steel, moved down to Utah County, and was the medical director there for 4 years, director of occupational medicine with U.S. Steel. That's another area of preventive medicine. And for a short time, Intermountain Healthcare asked me to help them set up their WorkMed clinics. So I, with Intermountain Healthcare, started the first WorkMed clinics. They were in Ogden. I was living in Utah County, long commute. In the meantime, the Board of Health in Utah County, because their health officer had retired, asked me if I would apply for that position. And so I said, sure. And I was the director of the Utah County Health Department for 32 years before coming here 2.5 years ago.
Very nice. So within your long career in public health, which topic has intrigued you the most?
There are many different areas of preventive medicine. What intrigues me about public health is your influence for and in behalf of many more people. Basically, your entire population you're assigned to work with is your patient. And at the steel plant, it was the 2,000 employees at the steel plant. As Utah County Health Director, it's basically the currently over 500,000 residents of Utah County. And with the state of Utah, it's basically addressing conditions that affect the health of people for better or for worse, and trying to decrease conditions that contribute to health problems and promote programs, interventions that promote health of a general population.
Sure. So when you first started your career up until today, what have you noticed has been the biggest change within public health?
Well, eventually the change has been that a lot more people than just public health and government are interested in keeping people well, because the cost of health care is very difficult to control. Even health insurance companies and health plans and hospitals are interested in addressing what they can do to keep people well and save costs in health care. So suddenly they're interested in population health, which is public health. The populations they serve in their health plans or in their facilities, and say, what can we do to prevent these costs that individuals are incurring, we're incurring in treating these individuals, and look at the population in general that they serve. Another huge change in public health has been investment by the federal government in the infrastructure of addressing preparedness. And this really was stressed and emphasized with the September 11th, 9/11 incident in 2001, just prior to the 2002 Olympics, actually. Previous to this, we all knew that it was an important part of public health activities and service was to help the public be prepared for disasters, emergencies. But also following that, the anthrax attacks. Again, a terroristic event with an infectious disease. Suddenly we said, oh, look, the public needs to be a whole lot better prepared for these types of public health events that are disasters, either natural disasters like earthquakes, but also these intentional disasters created by terrorism or unexpected or emerging infectious diseases or intentionally inflicted infectious diseases like anthrax. So the funding from the federal government to address those was the first time really there was any serious investment in the infrastructure of public health nationwide and here in Utah to be better prepared and address on short notice, anticipate these types of events and respond to them. Realize the importance public health plays in responding to these. Not just public safety, but it's public health in general helps the public be prepared and assists with the response to these types of incidents.
Great. Could you share one or more of your most memorable moments within public health?
Well, a memorable public health event, event in general for Utah was the 2002 Olympics, where we were interested in addressing public health risks and issues for the Olympic community, all of the tourists that would be coming for that, and what we can do to make sure we have no catastrophic events to endanger people, whether it be with injury or food safety, foodborne outbreaks, or possibly intentional attacks on gatherings of people. And so that was a great collaboration with many different agencies to address the safety of people during the Winter Olympics of 2002 here in Salt Lake City and the surrounding areas. The pandemic flu of 2009, the fear of pandemic flu in 2009 was a huge thing at the time when we were planning for it. It turned out to be a lot more influenza in our population than we had thought, but it really turned out to be not nearly as deadly a flu as most pandemic influenza outbreaks are. So, but anticipating that and seeing the interest among people because of this unknown fear of how deadly this influenza will be, generated tremendous interest in the public in getting those flu shots that had some limited availability, especially early on. And we had lines of people circling 2 or 3 blocks around the buildings of our immunization clinics for people waiting to get the vaccine, hopefully, and prioritizing who would get the vaccine initially when it was limited as in supply. It was very interesting exercise and undertaking by public health, but also the general public and their interest in it. Sometimes we wish they would be that enthusiastic about other things that we do in public health and keeping people well.
Sure. So one of the topics that we address is the physical activities. What personally do you enjoy doing to keep yourself physically active?
You know, I do a lot of physical activity, has just been running to and fro with lots of different things, but regular things I enjoy are yard work. I love to garden and prune trees and take care of yards and landscapes. I have planted hundreds and hundreds of trees in my personal career and helping to contribute to the environment, but I enjoy growing things and seeing attractive landscaping.
That's great. What are the 2 or 3 top priorities that you would like to achieve within your tenure with the Utah Department of Health?
Well, usually a tenure here as the state health officer can be fairly brief. Nationally, the tenure of state health directors is just 2 or 3 years on average. Some are longer, but some are shorter. So I think it's just the general appreciation and encouragement of employees to enjoy what they do and realize the importance of what they do to the community and to respect everyone in the public and respect them as individuals with their interests, but also be sincerely interested in helping them have a happy, successful life, whether it's co-workers or the general public, particularly, and be as involved with as many people as you can to promote that. That I think is important, and that requires a lot of collaboration with just anyone who wants to work with you. I mean, many of the priorities we have now, we have 3 strategic goals, and one is to have the healthiest people. Utah has, according to the United Health Foundation, the 4th healthiest state in the nation. That's one of our strategic goals, but there's still important areas for improvement. Another area is optimizing Medicaid. Medicaid is a way to help people who are lower income have adequate health insurance, health coverage to help them enjoy the health that people of higher income enjoy. And that's important part of public health. And then the third area is having a great organization. And there again, that has to do with great customer service with coworkers, working as an organization, but also great customer service with the general public, and be recognized as being very responsive and helpful to anyone in the community that's interested in our participating with them. As far as healthiest people, we do have what's called the Utah Health Improvement Plan. This addresses 3 areas of particularly importance that have been in the news almost every day, and that's addressing mental health and suicide. Again, very common condition. We all have mental states that we deal with, just like our physical health, and addressing that and helping people have care and be included and not being excluded, and having ways to get help for a mental illness that leads to suicide is very important. Suicide in Utah is much higher than the national average. That's true of all of the Intermountain states, and there are important things that can be done to address suicide and prevent it. The other areas with substance use disorders, opiate use, particularly because it's so addicting and dangerous if someone overdoses, particularly accidentally, because that's actually the most common way to die from opiate is to accidentally overdose. You go to sleep and quit breathing and die, and that's Utah has been one of the worst states in the nation. We still, with our rate of opiate overdose deaths, we are still in the top worst 10 in the nation, but we're not as bad as we used to be as far as comparison with other states. And then another prevalent condition that we're addressing is obesity. Utah is actually, compared to other states, not as bad as most states in the percent of our adult population that is obese, but we're getting worse, maybe not quite as fast as other states, but it's an issue that is addressing obesity and chronic diseases related to obesity, which would be diabetes particularly. Also heart disease and stroke that are associated with diabetes and obesity in general.
If you could make one lasting impression on public health, what would that be?
Again, is appreciating the importance of public health and preventive health in keeping people well. And the difficulty with it is impressing on people the success of public health. If you don't have good data and cannot show statistically or with data that public health makes a difference, it's very difficult to convince people it's worth it. Because if people are not getting ill, how do you prove that they would have gotten ill or become ill? You're trying to prove a negative. But with data, you can actually show an improvement in a population with a certain health condition. For example, with vaccine-preventable diseases, the rate of death from vaccine-preventable diseases is minimal now compared to what it used to be. Infant mortality, even when I started my career, infant mortality in Utah was, at least Utah County, was over 10 deaths for every 1,000 live births. Now, over the last 35 years, that's been cut in less than half, down to 4 deaths for every 1,000 live births. So quickly, people forget that you used to have over twice as many infants die just 35 years ago in Utah County than you see die now. And yet people don't really realize what has contributed to that. And getting people to appreciate what has been accomplished is not always that easy. And yet it's real if you look at history and have good data, you can show that. Basically, all you need to do is walk through cemeteries, old cemeteries where people have been buried over the last 100, 150 years, and see how many infants and children are buried there that you don't see nearly at that rate now. Those were from vaccine preventable diseases. But so quickly, after a couple of generations of people that aren't seeing, parents, children, generations don't see this, they quickly think that, it wouldn't occur. And basically, immunizations didn't accomplish that. There must be other reasons that accomplish that, so we don't need immunizations. That's something that is hard to impress upon people, that you can easily return to what we used to have if we don't continue and improve on keeping a population healthy through these different public health interventions. The Spanish philosopher George Santayana and others have had similar type concepts in their quotes, but he said, people who fail to remember history are condemned to repeat it. And this is true with, especially when you're dealing in something that relies on history and data to show your accomplishments. And that's critically important to appreciating preventive medicine fields and public health fields.
That's great. One final question I have. What do you enjoy the most about leading the Utah Department of Health?
I love interacting with people, the general public, coworkers, seeing how fabulous they are in their specialty areas. They're much more accomplished and better than I am, and appreciating them and their contributions to the overall picture is extremely important, and I appreciate that very, very much, that everyone can contribute an expertise that I don't have and many others don't have in that, particularly in that field of interest that they are good at and expert at with their education or their experiences in many ways, and study. Yeah.
Dr. Miner, thank you so much for taking your time. I know you're a very busy man, so
you're welcome.
To give a little perspective and insight into your history and to some of the efforts you're making to bettering public health means a lot. Thank you again.